is Erica Sibinga. I'm a general pediatrician at Johns Hopkins School of Medicine. In the practice where I work in inner city Baltimore, there's some interest in additional therapies and modalities, often to support mental health, behavior, learning challenges, and to help with physical activity in particular places and activities that their children can engage in around the city where they may or may not feel comfortable in the parks or in their neighborhoods. There's a limited sort of engagement in full integrative therapies in the particular urban area where I practice, although there is some interest. There is still a bit of a prevalence to stay in siloed disciplines. There's increasing interest in integrating approaches, both in pediatric integrative medicine or in pediatrics, and also in education. I think the reasons are important. There's increasing evidence, there's great needs for additional approaches for the problems that our children are facing, like obesity, attention problems in school, learning differences, feeling stressed out, and there's a huge sort of issue around anxiety, depression, and psychological strain in children these days. So the identification of these additional approaches that we may be able to integrate into either pediatric care or educational systems can be very beneficial for the children. For children in middle school and in urban areas in particular, that we find that the children use the practices to help them avoid conflicts and to be able to walk away from what they say would have been a fight in the past. And I think the ability for children to learn that skill really is important. And the youth tell us that that is a meaningful thing for them to feel able to do. I think the benefits of these kinds of approaches are multifaceted. I think there can be benefits in terms of learning self-regulatory capacity, improving psychological symptoms like having less anxiety or less depression, for instance. And those outcomes are important in and of themselves. They have meaningful applications in children's lives. I think there are also benefits in terms of academic outcomes and things like improved relationships, either with their peers. We also see improved relationships with family members, with parents. And I think that the importance of those kinds of benefits really can be pervasive for a child, can help them navigate their childhood, their school life, their family life, and their neighborhood life in meaningful ways.